So there's no one here. I don't have a patient here right now. So I always tell the patient, I say, hey, the doctor talked to you about your inhaler that you're going to get today, or the breathing treatment that you took. We go over because most of the times when they order the Flovent or the albuterol, they kick it up with depending on how bad the person's respiratory system is or how their lungs sound, they will kick it up with the order of nebulizer treatment through albuterol. So I would bring in the machine, the Opti or Aero chamber as an example to show the patient, and some other inhalers, which this is the Ventolin albuterol inhaler, and I go over that it's a meter. It gives out your exact dose that you're gonna get. And we have these little handy dandy guides. I hope this isn't cheating, but this is something that I do every day. But I go over how these medications is to help the airways. I explain this to parents because we have to document whether we explain it to grandma, mom, and child. If the child is old enough to understand, 9 above, we like to do what is called I teach, you teach, or a teach back method. So I go over right now, your airway is kind of like this. So you're doing, and you're not breathing or getting an effective way to breathe right now. And what you're being prescribed today is the Flovent inhaler. That's the daily medication. And I always emphasize, what is the Flovent? Can you tell me what the Flovent is? And they tell me it's a daily medication, that it is preventative medication. All right, the Flovent is this orange inhaler that you're gonna get right here. It is a controller med. It prevents your airway from going to that picture where your airways are like this. We want them like this, open and able for air and blood to move through. So it's a steroid, so it does take down some inflammation. And most of the questions that I get, oh, it's a steroid, it's gonna make me fat, it's gonna bulk me up. You're not taking an oral steroid, this is inhaling steroid. It's going to go straight to the place that it needs to go for an effective result that's gonna open up your lungs or open up your airways. I also go over that it can be used with a bronchodilator, which, ta-da, is this. This is your rescue medication. This is not to be taken every day. Again, I ask the patient and the parent, please, what is this medication for? This is not for everyday use, but this is the rescue medication. If you feel like you are belly breathing, shortness of breath, and can't catch your breath, you would take the 2 puffs of the Flovent daily, morning and night, what the doctor ordered, but you will also add it with this at the time that you need it. You will be getting sent home with both. It's a combination that treats and manages your asthma. When taking these medications, I urge you to please rinse out after every time you do your inhalers. Again, after every time you do your inhalers. And teach that back to me. I let the patient tell me that this inhaler is for only rescue, only when needed. The Flovent is for a daily preventative. We want that daily preventative medication so it keeps your airways open, nice and open. One of the other questions I usually get is, what can happen to me on this inhaler? Well, it can cause some fungal infections. So I repeat, please rinse your mouth after every use of this inhaler. It can cause some mouth irritation, throat irritation. It can cause you to cough. It can cause a headache, nausea.